Welcome to another deep dive into a couple of really fascinating articles from the world of ECMO.
Yeah.
Both were written by Jonathan Bijung,
Okay.
who you might know as a respiratory therapist and ECMO specialist.
Right.
And today, we'll be kind of jumping between two pretty different topics.
Okay.
The first is a really moving story about an organ donation that took place in Vietnam.
Oh, wow.
And then we'll be kind of shifting gears and talking about the specifics of postoperative cardiac surgery protocols, which are sometimes also called PCS CALS.
It's interesting how those two things go together.
Yes,
you know, seeing that generosity of organ donation and then seeing how we save lives after surgery.
It really does show the breadth of what we do in our field.
Yeah, absolutely.
So let's start with that story from Vietnam.
Okay.
This takes place at Bach Mai Hospital in Hanoi.
Okay.
And a 36-year-old man named Lake Tien Sun passed away after a cardiac arrest.
Oh.
And in the midst of their grief, his family decided to donate his organs.
That's incredible.
It's very compassionate.
Yeah.
What really struck me was this video that Jung shared.
Okay.
It actually shows the operating room staff directly addressing Mr. Sun before they retrieve the organs.
Oh.
And they say in the translated words, let Tien Sun, when you fell ill, your family brought you to Bach Mai Hospital for emergency treatment. Our doctors dedicated themselves wholeheartedly to saving you, but sadly, we were powerless to change fate. However, we believe that wherever you are, you will be at peace.
Oh, wow.
And then they go on to ask for his permission to proceed with the donation.
That's powerful.
And they call him a gentle and compassionate soul.
Oh, my goodness.
It's pretty moving.
It is.
It really personalizes the impact of these decisions.
Absolutely.
And Jung points out that there's a similar practice that's done in China, where sometimes the family members are even present in the operating room.
Really?
So it seems like this respect for the donors is pretty universal.
It is a universal thing.
And it makes you think about those families that we work with as ECMO specialists.
Yeah.
You know, they're facing these incredibly tough decisions in these moments of crisis.
Absolutely.
So that brings us to Jung's second article.
Okay.
Which focuses on PCS sales.
Okay.
And these protocols are endorsed by organizations like the Society of Thoracic Surgeons.
Right.
And they're specifically designed for managing cardiac arrests.
Okay.
Following cardiac surgery.
So why is this so crucial?
Well, because you might find yourself in a situation where a patient just had cardiac surgery.
Right.
And then experiences a cardiac arrest.
Yeah, of course.
So understanding PCS scales can mean the difference between a successful intervention and a negative outcome.
Absolutely.
Now, they do share some common ground with ACLS.
Okay.
But there are some key differences that are tailored to the unique needs of these patients. So what are some of the things that set PCS-CALS apart from ACLS?
Okay.
What are some of the things ECMO specialists need to keep in mind?
Well, one major difference is the focus on rapid defibrillation.
Okay.
So for ventricular fibrillation, or VF, PCS-ALS actually advocates for 3 stacked shocks before you start external compressions, as opposed to the single shock approach that we use in ACLS.
So it's more aggressive when it comes to defibrillation.
Exactly.
Because of the urgency of those situations.
Yeah. And it helps protect surgical sites and potentially restore that normal heart rhythm faster.
Okay, that makes sense.
Yeah.
Another big difference is the approach to adrenaline. PCS-CALS minimizes or avoids high-dose adrenaline.
Really?
Altogether.
I would think that adrenaline would be pretty important in resuscitation.
You would think so.
Yeah.
But in this specific case, we have to think about the vulnerabilities of a post-surgical heart. A sudden blood pressure spike from high-dose adrenaline could damage grafts or surgical repairs.
Oh, wow.
So PCS-CALS takes a more cautious approach, recognizing those risks.
Gotcha.
Are there any other major differences?
Yes. If those initial efforts to revive the patient fail, PCS-CALS advocates for an emergency sternotomy within 5 minutes.
Wow.
This allows for internal cardiac massage, which can be much more effective in these cases.
So PCS-CALS is all about rapid intervention.
Yeah.
Tailored to the needs of the post-surgical heart.
Exactly.
Now, it doesn't completely replace ACLS.
Right.
It's more about adapting our approach
to
the specific needs
Gotcha.
of post-op cardiac surgery patients.
Okay.
And having a well-coordinated team is crucial.
So let's talk about the team.
Yeah.
Who are the key players in a PCSCS CALS?
Okay, so picture yourself, you're in a cardiac surgical unit or ICU,
Okay.
and a patient suddenly goes into arrest.
Okay.
Ideally, you would have 6 key players.
Okay.
The anesthesia provider, the bedside nurse, the surgeon, the perfusionist,
Right.
respiratory therapist, and the circulator.
Wow, a whole team of experts.
And each role is critical
Yeah,
in this fast-paced environment.
absolutely. And the coordination between these team members is crucial.
Wow.
Like, take the surgeon, for instance.
Yeah.
They need to be ready to perform that emergency sternotomy we talked about,
Right.
if necessary.
Yeah.
And having the perfusionist on hand is critical,
Right.
especially if ECMO support becomes necessary.
So seamless communication
Yeah,
and collaboration is super important here.
absolutely. It's not just about following a set of algorithms. It's about understanding the nuances of postoperative cardiac care
Okay.
and working together seamlessly as a team.
This is a fascinating look into a very specialized area of care.
Absolutely.
It shows how important it is to keep learning to work together and to keep pushing the limits of what's possible in our field.
Well said. And to everyone listening out there, keep learning, keep those skills sharp.
Yeah.
And keep striving to be the best ECMO professionals you can be.
Thank you for joining us for this deep dive into ECMO and postoperative cardiac surgery protocols.
Yeah. Thanks for listening.
We hope you found it useful and insightful.